today's kind of fun because I mean, most of the time, anytime I do a talk, we gotta screw up with people's belief systems. You know, we've got to go in and say, yes, the blood pressure medication is causing the dementia. You know, and then we got to go through and show facts. Today, we're going to talk about the science of real, true healthcare. Okay, chiropractic. Now, there's a change and a shift in a lot of the colleges. They're actually starting to make chiropractors and give them the opportunity to sell prescription drugs. And not only is that, what would the reasoning behind that? Is it because the public doesn't have sufficient access to prescription drugs? No, there's a damn pharmacy on every freaking corner. I live about 3 miles away and I got to pass 8 of them. Okay, so there's no reasoning behind it. But what's happening is this is a threat. The largest drugless healthcare profession in the world. That means the philosophy of real chiropractic is that the body is intelligence, that there's an innate inborn intelligence in the body, and that to reverse disease is to express that intelligence. Now, so we're going to go through, and luckily, we're going to just bring up facts and science. I mean, B.J. Palmer was one of the founders, even though, I mean, when you look at the history, we're talking Hippocrates, 400 B.C., get knowledge of the human spine. For this requisite is for many diseases. You know, when confronted with disease, first look to the spine. He also said that. One of the first documents in China was 2700 BC, talking about people looking to the spine for health. And there have been bone setters in virtually every culture. Because if you look at the spine literally is it controls and coordinates every function of the body, the nervous system. There's no effect without a cause. Chiropractors adjust the causes, others treat the effects. Now, people are surprised to find out that it takes longer to go to school to be a doctor of chiropractic than to be a doctor of medicine. Now, when you look at this, I don't have the course hours listed, but we have about double the anatomy, double the physiology, way more pathology, and very little pharmacology. Why? Because we're the largest drugless healthcare profession. We don't try and give a toxic chemical to alter physiology. And this is the philosophy of the world now. I mean, when you look at it, the medical philosophy is that disease starts because bad genes, bad luck, your stuff wears out. Okay, it's really that stupid. And then they've broken the system up, or the body systems, into segments because you're just a collection of parts. See, these parts don't have anything to do with each other. The cardiovascular system doesn't have anything to do with the digestion. That's why the gastroenterologist isn't taught about the autonomic nervous system. That's for the neurologist. Do you understand the disconnect there? It's just a collection of parts. Now, so what does that do to our health now? It's not getting it better. I mean, if you look at today's generation, this generation will not live as long as their parents. Okay, the leading cause of death and disease in this country is the medical system. Because of this, the philosophy behind it, this guy he's probably one of the most brilliant writers, one of the most brilliant medical doctors, Dr. Bergman D.C. Okay, water cures, drug kills. Now, he is a medical doctor of the highest caliber. He doesn't drug people. He actually started to experiment with giving water. Okay, and found out a lot of diseases like high blood pressure, arthritis, all these conditions were from dehydration. He found out that these conditions weren't actually diseases, even though when he was practicing that he would treat it with different chemicals or different drugs. And I had to put this quote up here because this is just brilliant. And he's talking about the medical society or the medical system when they realize that the entire paradigm, the entire philosophy of drugging people to get their symptoms in line is foolish. all of a sudden they will feel naked. They will see the many years of learning and memorizing scientific jargons, all the statistical analysis for justification of treatment protocols using toxic chemicals or invasive procedures, and the price structure attached to these acquired skills is declared obsolete. And that's what we're entering now. When we're looking at the medical approach versus how the body actually functions. So we got to go over what chiropractic is and what it is not. Now, there's a number of chiropractic colleges that are completely confused. They're the ones that are trying to medicalize the system. Now, back in the 70s and 80s, a lot of prostitutes masquerading as chiropractors decided to change their point of view from a healing art into back pain, neck pain doctors. Okay, they thought, oh look, if you just shut the heck up about actually getting people better and reversing disease and just subjugate yourself to a small, uncomplicated low back pain and neck pain, then you can get part of the insurance. Okay? And a lot of these people who had no ethics or morals, they thought, oh great, I want to be like a real doctor too. Okay, so they prostituted themselves. Well, chiropractic is not alternative care. It's not. It's been around thousands of years longer than this drug profession that's only been around 120 years. This is not complementary care. Hell, I'm antagonistic. Okay, I'm confronting. Okay, I am not complementary. I'm not alternative. This is the only care worth anything. I mean, if you got a drug or shoot someone, great. That's ideal for acute trauma, but not for health. Chiropractic is a unique, distinctive healing art, and I'm going to explain how there is an innate intelligence that has to be expressed. We are not muscle or bone doctors. Okay, that's ridiculous. We are nervous system doctors. Has anyone ever seen, because you know how they blame muscles? Oh, it's piriformis syndrome. I got a tight quad. My flexors are really bad. Okay, have you ever heard that? I know you never have. But okay. How can a muscle react on its own? Do you understand that? That's impossible. I mean, it's true. Heidi did have a steak the other day and it ran around on the floor. And she said, well, it's in spasm. She's got a really sick sense of humor. Okay. Chiropractic is not massage. Okay. Good God. Yeah, I'm causing deep inflammatory responses at the level of the disc to reverse arthritis. Massage feels good. This is totally different. It's not for back pain or neck pain, although, back pain and neck pain tend to resolve when you find out what the hell the cause is. But to come to a chiropractor for back pain and neck pain is foolish. Go out, get a Motrin, get a Tylenol. Okay, yeah, granted it'll destroy the kidneys and it'll weaken the immune system and deteriorate the joint, but Jesus, if you're going for pain, great. If you want to get an intelligent response and find out why the symptom is there, then this is what you do. And it's not for symptom relief. Good God. It's like, you got a red flashing line on the dashboard that's a symptom, and you got a doctor that says, hey, I got a bunch of black tape, we'll just cover up those red lights. You'll be just fine. Now, this is where we get into philosophy of vertebral subluxation. Now, there's a number of different challenges when you look at this. Now, in the medical jargon, it's known as a bone that's slightly misaligned. Okay. In traditional chiropractic jargon, and I was the last class of Dr. Carl Cleveland II. Now, I got to tell you, when I was going to school, and this was totally cool, I had no money. I'm living in a storage unit with 2 kids. Has anyone ever done that? It sucks. Don't do it. Save money. Try and change your lifestyle so you don't have to live in a storage unit with 2 kids. But the advantage of that, when I was working at the school, I worked for every department. And so I'm down there in the maintenance. Okay, this was my first trimester at school. And I'm building some cabinets, and I see all these rabbit cages. And I thought, rabbit cages at a chiropractic college? What are they there for? And so I saw these little harnesses, and so I'm asking, none of the maintenance guys knew. So then I asked some of the old timers, and they said, oh yeah, we used to do experiments on rabbits for kidney function. I said, what? They would take rabbits in these cages. They had these screws that would subluxate or move a bone slightly out of position. They would measure kidney function with it under pressure. They would take the screw pressure off, and then they would measure kidney function. So they were proven back in the 50s that, my God, you can alter kidney function, or if subluxations were there, there was a somatic-visceral relationship where you can affect the body and affect the organ systems. I only found that out, thank God, because I was working for maintenance. And I thought, wait a second, this is not back pain, neck pain. You can have a visceral response. And then I asked the guy, Carl Cleveland, II, what's his definition of vertebral subluxation? It's a vertebrae that's lost its juxtaposition, a relationship to the vertebrae above and below, affecting the nervous system. Wow, that's cool. Now, a lot of the colleges are not utilizing subluxation anymore. Okay, what do you want to call it? George syndrome? Harry's? You know, I mean, you know, so it's foolishness, because they're trying to get, they're trying to prostitute themselves so they can start selling drugs. So they're trying to get rid of the words that built our profession. Okay, now sub means less than. Lux is light, and action is it's a result. So what a subluxation is, or what a vertebral that's misaligned, that's affecting the nervous system, it's less light going into the body, less energy. So the term was coined because there was something less, that there's almost a healing force, an innate intelligence that flows from the brain down above to animate and give tissue life. And this is what chiropractors work with. So this is the philosophy. It's not to deal or to eliminate symptoms. It's to respect the body, that the body comes up with these symptoms or adaptations to trauma, toxins, and thought. And that there's a pattern behind this. And what's interesting, it's not that we're exposed to trauma, toxins, and thoughts. It's the inability to adapt. Okay, does that make sense? Because we can deal with trauma. Okay, I mean, you could deal with the loss of a loved one, the loss of a job, the loss of limbs. Okay, but eventually you get to so much trauma where it's really going to negatively affect you. Okay, now there's certain aspects of this, and I got to apologize for the small print. Kinesio Pathophysiology means it's not moving correctly. Not moving correctly can affect the nervous system. This can affect the muscles. This can affect the cells. And then you end up presenting with pathology. And that's why we have the Kinesio Pathophysiology, the Neuropathophysiology, the Myopathology, the Histopathology, and the Pathophysiology. So there's a sequence to these events. Now, what I want to show you here is this is a normal side curve in the neck. This one on the left is a reversal of the curve, and this person presented with depression. Now, do we treat depression? No. But do we look, has depression or anxiety, has perhaps less dopamine being produced? Do we give them dopamine? Or do we realize that if that neck curve is not there, that it's actually pulling on the brainstem and can alter, or there can be a somatic, a subluxation of the body affecting the organ systems? God, that makes sense. Here's Dr. Sue out of the University of Colorado. If subluxations are not corrected early, when they are caused shortly after birth, the subluxation will be difficult or impossible to correct later. Subluxations can reduce nerve impulses by 60%, or impulses by 60%. Think of that. Who would like 60% going to the heart? You want 100%? Okay, how about 60% less influence going into the brain? Anyone okay with that? No? Okay, granted, that would be an increase if you're talking about the politicians that are running tonight. So they're saying 60%, that's great. I'm running on just 10%. Okay, so that would be a huge influence. Yeah, I have no respect for our election procedure. Okay, yeah, particularly when these guys are running. Okay, what does Harvard Medical School say about subluxation? Research indicates that the major cause of spinal kinesio pathophysiology in infants is childbirth and its widespread incidence during infancy. In our minds, stressing the need for correction from birth so that irreversible subluxation, degeneration, changes do not occur. This guy from Harvard is saying, By God, don't wait for pathology. Check children immediately. Okay, does that make sense? Because do you want a child growing up with 60% nerve impulses? No. Here's out of the Journal of Chiropractic Medicine. Sympathetic and parasympathetic response to specific diversified adjustments in chiropractic vertebral subluxations of the cervical and thoracic spine. Now, I'm not going to read the whole article, but what was interesting in this, they were measuring diastolic, systolic blood pressure. The conclusion, it is preliminarily suggested that cervical adjustments may result in parasympathetic responses, where thoracic adjustments result in sympathetic responses. Furthermore, it appears that these responses may demonstrate the relationship of autonomic responses and associate to particular segments adjusted. This means if you adjust the area where the parasympathetic or sympathetic is, you can affect the autonomic function. Is that important? Understanding that autonomic function is blood pressure, heart rate, immune system, kidney function, liver function, digestive system. Oh wait, should I go back to that elephant with all the blind guys looking at it? Okay, and explain the medical model? How they're looking at altered digestion, they're looking at altered lung function, they're looking at altered immune system, they're looking at autoimmune disease. Do you see how stupid that is? Okay, I don't know, let's look at some more research. Okay, Journal of Manipulative and Physiologic Therapy, 2000. Recent neuroscience supports the neurophysiologic rationale for the concept that an aberrant stimulation of the spinal or paraspinal structures may lead to segmentally organized reflex responses of the autonomic nervous system, which may in turn alter the visceral function. In English, okay, this means you screw up the spine, you subluxate a spine, you can alter organ system function. Does that make sense? So now, if any profession, if you have a profession that is working on that organ system, you have somebody actually working on the heart, and they're not paying attention to what controls the heart, is that foolish or foolish? I think it's foolish, you know, I mean, only if you can read. I mean, if you could read, you would understand that, or if you actually took more anatomy and physiology, you would understand that. The somatic sensory system of the neck and its effect on the central nervous system, GMPT. This is, again, they're talking about the motor control, sensory input, the neurophysiologic evaluation of the subluxation complex. They're talking somatic sensory evoked potentials. Again, this is more organ system involvement. We're looking at somatic dysfunction of the phenomena of visceral disease stimulation. This means you have a bone out of place, or the bone is changing, proprioceptive firing. You bone out of place and putting pressure on the nerve has never been shown. But a bone that is subluxated, since sensory input into the brain can alter organ system function. Have you ever heard of that? Isn't that amazing? And that's what we're looking at. Furthermore, it's not unreasonable that the somatic visceral disease mimicry could well account for the cures of presumed organ disease that have been observed over the years in response to various somatic therapies, e.g. spinal manipulation. So we've seen cures. Wait, did that say cures? So we've seen cures and reversal of organ system diseases year after year after year. Now, these are not just case studies. These are absolute cures, and we're going to get into that. So what is this theory? What is this principle of chiropractic? It's that there is an innate, inborn intelligence in the body. And Dr. Jacobson, like if this was a rock, he would say, is there intelligence in this rock? There is. There's density, there's matter, there's an electrical charge that holds those particles together. There is an intelligence in that rock, but it's the intelligence of a rock. If I was to drop dead right here, what would you say? You know, I mean, yay, he's dead, now they get the life insurance, you would be happy, okay. But I'm talking about the average person, okay. It's all mine, my kids would say, yes, the empire is mine, okay. No, but if I just fell dead, what would you say? You would say, well, gee, Dr. Bergman is a good guy, but he's left us. But my bones would be here, my body would be here. How could you say that I'm not here? Because there's a life force. See, people are under the delusion that eyes see, that the stomach digests, okay, that the lungs breathe. Cadaver has those. They can't see, they can't breathe, they can't digest. So there is a life force, there is an energy, and this is something that's totally discounted by the medical system. Now, ADIO means above, down, inside out. This means disease as well as healing has to occur from the brain above down to animate the tissue and come out. Subluxation, which is a mechanical dysfunction of the vertebrae that blocks this normal function of the nervous system. Vitalism is based on healing only occurring when the body's own healing powers are activated. A surgeon that goes in there and cuts and sews it up, can he heal that wound, or does the body have to heal itself? Now, when you have a cut, do you have to say, hey, wait, hold on a second. I got a cut here. I got to think about this. Or does it heal on its own?
It heals on its own.
It heals on its own. I mean, this is really cool. Now, okay, granted, I want to look like this when I'm older. I think he's cool. This is B.J. Palmer, the son of one of the modern founders. The body has an innate intelligence, that is the wisdom of the body to heal itself. Health is a natural state. I mean, it seems almost too unbelievable to have a philosophy like this. Now, the science of chiropractic, the nervous system controls and coordinates every function of the body. Every doctor learns that. Okay, what they forget though is that the body is self-healing and self-regulating. Every doctor learns that. But how come the medical profession doesn't practice it? Yeah, the body's self-healing and self-regulating, but by God, your blood pressure isn't working right. Here's this diuretic, here's this beta blocker. Oh, you got cardiac arrhythmias now? Pacemaker, table one. Can you see how stupid that is? Okay, let's imagine if the nervous system really does control and coordinate every function. Let's look at the autonomic nervous system. This is where chiropractors live. So we got two autonomic nervous systems. One, you already saw, adjusting the cervical spine where the parasympathetic nervous system is can alter visceral function. It can change diastolic, it can change systolic. We're talking, it's changing blood pressure if you take the pressure off of it. But this is the actual structures that we work with. Parasympathetic is called the rest, digest, and repair. It's located in the neck and sacrum area. If you have a problem with regeneration of tissue, or you can't sleep, or you have digestive issues, do you think that the rest, digest, and repair, the parasympathetic nervous system, may be negatively involved? Yes or yes? Okay, if you have high heart rate, high blood pressure, high cholesterol, digestive disorders, immune system problems, do you think possibly the sympathetic nervous system may be involved? Or at least, at the very least, don't you think that it should be checked? Yeah, I would think so too. Now, the Art of Chiropractic, I like B.J. Palmer because I like objective analysis. I don't like to have, oh yeah, gee, I don't know, maybe you're not good. You know, because there's some chiropractors that don't use x-rays. And I got to be truthful to you. I ordered when I was 14 years old these x-ray glasses. Not for therapeutic benefit either. They never came in. But there's some chiropractors that don't need x-rays. I'm not that good. I've been doing this for 20 years. We see about 200 people a day. I'm not good enough to touch someone and say, yeah, you have grade 2 arthritis and you have a 5-degree lateral deviation and subluxations at C2. I actually got to go in there and take a friggin' film and say, yeah, you got forward head carriages so many millimeters. I need to see what's wrong. B.J. Palmer did it over 100 years ago. We got to find the problem, identify the problem, fix the problem, and show the problem was fixed. Wow! Okay, I'm just thinking that's cool. Okay, so now the truth, and this is where art comes in. This is where the philosophy comes in. We chiropractors work with the subtle substance of the soul. We release the imprisoned impulse, the tiny rivulet of force that emanates over the mind and flows over the nerve cells to stir them into life. We deal with the majestic power that transferred common food into the living being. Wow. This is the future of healthcare. This is respecting the body's processes. This is saying diseases is a lack of ease. Lack of ease. That it's not really an entity. If you've heard of irritable bowel syndrome, if you've heard of cancer, what does it look like outside of the body? What shape is it? What color is it? Or do those diseases, are they just a manifestation of deficiency or toxicity? I mean, look at the miracle. We know this happens. We know that sperm hits the egg. We know the nervous system starts to form. I mean, you get implantation, it turns into this mulberry cell, where cells divide 2 cells to 4 cells to 8 cells. I mean, it just keeps dividing. Then it turns into this trilaminar disc. Then the trilaminar disc folds, and that fold is called the notochord. That's the beginnings of the nervous system. And then all the organ systems grow off of that nervous system. The nervous system forms first. Okay, you're talking the heart within 24 days, the eyes within 36 days. I mean, it's brilliant. We know it happens, but we don't know how it happens. We know there's a life force, an entity, but we don't know how it works. Now, one of the things when you're looking at this, postural distortions happen. So when we're talking about trauma, toxins, and thought leading to a lack of ease or a disease, do you think that person on the right has had more share of her physical force loading, of trauma? Yeah. So we need to take care of that. Having those shoulders rounded over and down. Should she have the same blood pressure as the younger person or the person on the left? No, or should she be adapting because she is dealing with trauma, toxins, and thought? So the chiropractic philosophy is we're not going to look at pain, we're not going to look at the blood pressure, we're not going to look at diabetes. If you look at all of these are not diseases. They're the body adapting to toxicity and deficiency. Is it foolish to give a pain reliever for that, like non-steroidal anti-inflammatory, Advil, Motrin, Aleve, ibuprofen, knowing that those destroy joint cartilage? They damage the kidneys. They increase heart disease. Is it intelligent to give an antibiotic for an infection that can destroy the normal gut flora? Okay, in life-threatening circumstances, absolutely. But you give it for bronchitis or ear infections or a common cold, that's foolishness. This was true 200 years ago. Doctors are men who prescribe medicines of which they know little to cure diseases which they know less, and human beings which they know nothing. By God, if you're trying to cover up a symptom, that's foolishness. This is a guy that comes into our office. Obviously, what I'm doing, I'm looking using x-rays, looking to see if a vertebrae is misaligned that possibly could be affecting the organ system. Does that make sense? This is the crap he came in with. Tylenol for joint pain. Yes, I understand it's the deadliest drug in America, damages the liver. I know. Okay, this is the dark ages. Okay, just bear with me. Don't be so upset. Okay, asthma, steroid inhalers. I know that's a drug that stimulates the sympathetics. I know that's going to shut blood supply down to the gut. I know he's going to have a weakened immune system. Just settle down. Jesus. Indigestion, Prevacid. Okay, I know that's a proton pump inhibitor, stopping mineral absorption, leading to cardiac arrhythmias. Okay, possible permanent decrease in magnesium absorption. I know this. Just Jesus. High blood sugar, metformin. I know type 2 diabetes is curable in about 30 days with a diet change. God, you people. Can you see this? Okay. And nobody tests the Tylenol with the Prevacid, with the inhaler, nobody knows what all 10 of these things are going to do. So how about we identify the problem and fix it and get them off the drugs in 90 days? Wouldn't that make more sense? So chiropractors do not treat disease. We look for one cause. And this one doctor, Fred Barge, wrote One Cause, One Cure. The nervous system controls and coordinates every function of the body. All the organs grow off it. They're all controlled by this. If you have a subluxation pattern like this, that person's in a sympathetic dominant state. You have a subluxation pattern like this where it has a free flow of information. The body can adapt and correct itself, or it can deal with the stressors, the trauma, toxins, and thought in the environment. So what we've got, this is the last guy I would like to vote for. Okay, I don't know if he was a really good governor, but isn't it fun to know that our governor can kick your governor's ass? I liked him. Okay, I know he doesn't look like this anymore, but still, okay. This is the real science. I mean, look at this. Chiropractic that respects the body, okay, that respects the human potential, that the human potential is 100%, no matter what the disease is, and we use the science to have it. So let's look at this. Here this girl comes in. She's on one of our testimonial pages. She had a grapefruit-sized tumor and a baby 3 months old, an infant, a fetus. And they gave her two choices. We cut the grapefruit tumor out and your kid's born deformed. We recommend you abort the kid and we take the tumor. So you got a deformed kid or a dead kid. She wanted option 3. She comes in here. Her sister brings her in and she says, a chiropractor? I don't have back pain. I have a tumor and a 3-month-old fetus. And I said, well, I happen to have a diagnostic ultrasound machine, so, we can actually monitor the progress of the fetus and the progress of the tumor. I know that the body is, self-healing and self-regulating? Anyone ever heard that? Okay, good, yeah. Okay, so I know the pancreas can knock out tumors. I know the adrenal glands produce interferon. They can knock out tumors. So let's adjust that area, stimulate the autonomics, get your rest, digest, and repair method going. You might be able to knock out the tumor. She says, okay, I like that option best. Okay, within a couple of months, the tumor had shrunk from a grapefruit size down to a lemon. About another couple of months goes by, it's now down to about the size of a lime. I say, look, let's not bombard the kid with any more high-frequency ultrasound waves, okay? Kid's born, no tumor.
Took it with him, huh?
Yeah, you're right. It might not have been the adjustment. The kid was a little aggressive. But look at this. It's not, this guy, when we saw him, he comes in, multiple sclerosis for over 20 years. Again, we're not treating the multiple sclerosis, but by God, you adjust that, you change in proprioceptive responses, you're changing information going up to the brain. He comes in and he's wearing shoes with shoelaces on them. And he says, look at this. And I'm looking at the shoes and I'm going, okay, they're shoes, He says, no, you don't understand. It's the first time I've tied my shoes, okay, in years. And then he says, you gave me my hands back. And okay, I'm tearing up. But can you imagine this? Okay, I'm a guy, I'm not supposed to cry, okay, but the girls were crying like crazy, okay? This guy, and again, we're not treating disease. That's foolishness. That system doesn't work. 69-year-old guy, 5 medications, 2 high blood pressure, a thyroid, an antacid, a pain reliever, and a partridge in a pear tree. Okay, find the subluxation, correct it, fix it, and restore normal function. Good God. 82-year-old gal. Bowel and bladder control problems. Can you imagine bladder control problems? You can't play with your friends. You can't go to bridge. You can't do everything that 82-year-old gals want to do. We got a bunch in their 90s that are going to stick class. Before, after, 90 days. Now, we're not adjusting the bladder. I'm not telling her to do anything but get her nervous system working right. Chris, 48-year-old, for 7 years, hip pain, bladder problems, pain with sitting, sexual dysfunction. And if you're looking at this and you're a doctor, you're looking at inflamed SI joints. So what would happen? She went to a bunch of chiropractors, got adjusted, hurt when she got in the car. Then she went to a physical therapist and they injected it with I don't know, lidocaine or cortisol or something, instead of just actually fixing the problem. We adjusted her, stabilized the pelvis. First visit, her pain was decreased. This gal, I want to show you beautiful knee joints. Those are gorgeous knee joints. She was all set for a knee replacement. Now, if you're honest to God, we see this all the time. Now, you might be looking at the patella, which is lateral. It shouldn't be lateral, so you're seeing a bilateral patellar tracking problem. Now, if I was to tell you that the knees are supplied by L3, the mnemonic, 3 to the knee, 4 to the floor. That means L4 goes all the way down to the floor, 3 goes to the knee. Okay, that's just so if you're passing boards, you can watch this and pass them. Okay, this is her lumbar. L3 is that worst aspect. It's the apex of the curve. She didn't have a knee problem. She had knee symptoms. How many times did she go to the doctor and get drugs for a knee problem instead of someone saying, wow, let's take a look, let's find out why the pain's there. Here's a failure of mine. Okay, here's a guy that comes in. Cardiac center's at the top of the rib cage. This is his thing in 2007, his x-ray. And I try to explain to him, my God, this is really bad, okay? If we don't correct this, you know, your cardiac arrhythmias are going to get worse. We got to get it fixed. No, I think it's Kaiser, okay, doesn't cover this. So he went over, got the beta blocker, the ACE inhibitor, you know, some physical therapy. Right now, what you're looking at, he comes back because the neck pain was still there. These are wires that lead from a pacemaker with a defibrillator unit. So now he's got a machine underneath the left aspect of his chest and a wire going through the superior vena cava, jammed into the floor of the right ventricle, so his heart's got to close over that wire for the rest of his life. Why? Because I didn't explain to him the importance. Because honestly, who would choose a wire in their heart over getting the problem corrected? Okay, everyone agree it's my fault? I think it is. Okay. Here's a similar guy. Cardiac arrhythmias. Do you see the problem in the upper thoracic area? That's the sympathetic nerve supply to the heart. 90 days later, that's him. Amazing. No cardiac arrhythmias. I'm speaking in Vegas a couple of months back, and I'm sitting next to a doctor, and I'm saying, you know, you'd have to be a complete asshole to prescribe Advil, knowing that a person has joint pain, and because it's going to destroy the problem. And I said, you know, why doesn't a cardiologist actually look at the autonomic nerve supply to the heart instead of giving a beta blocker? My wife leans over and says, he's a medical doctor. I lean over and I said, I know. He's probably going to watch this too. I know. Okay, so the body gives a cardiac arrhythmia because there's a freaking problem. Fix it. This kid, oh God, 2.5 years old. And I got to tell you, the seminar we went to, there was like 30 normal human kids there. We're talking unvaccinated, healthy parents, no vitamin K shot, no silver nitrate in the eyes, healthy, appropriate diet, breastfed, totally cool animals, okay? Running around bright, healthy, happy, looking around nice. Okay, here's a standard person, okay? Reverse curve in the neck from a C-section. A C-section puts 4 times the amount of pressure on a kid's head. Of course, they cut the cord right away. Multiple ear infections. So what do we do for that? Powerful antibiotics which destroy the normal gut flora. So since you're destroying the normal gut flora, what are they going to have? Asthma, ear infections, digestive disorders, behavioral disorders. This is a normal curve in the neck. So how are we going to fix that? We're going to get the parasympathetic working right. We're going to restore the normal gut flora. We're going to tell the parents to stop vaccinating, for God's sake. Look at the movie Vaxxed. Heidi, can you toss me one of the Vaxxed movies? You got to look at this, okay? This is a normal child. You're not going to see this, okay? Check out the movie Vaxxed. I recommend it. I've purchased about 30 copies of this. Anybody that says vaccines are proven safe and effective, except when the CDC runs a study and lies and hides the data so that 5,000 cases will be thrown out. Okay, so if you think vaccines are safe and effective, watch this. Okay, don't look at the cute kid. Here's another one where I failed. Okay, 58-year-old. Okay, nice, healthy. 58's young. Jesus, I'm 56 and I'm a kid. Okay, 6 months of care on and off. She just kind of didn't get the big picture. I don't see her for 7 years. She comes back. This is what she was like when she left. This metal stuff that she comes back. And guess what? They did the surgery. She had back pain before. Now she has back pain and leg pain. I'm just thinking to myself right now, this is a lot harder to fix. I mean, we're able to help her, but when you get a surgeon that bolts something down to the sacrum, it's really hard to fix. We were able to help her, but still. When you look at this, the curve in the neck is the arc of life. And again, you're not looking at symptoms. This is a normal curve in the neck. Those other two are abnormal. If it's pulling on the brainstem, you're going to have low dopamine production. Low dopamine, depression and anxiety, but also Parkinson's. These two are Parkinson's patients. Can you see that? Movement triggers dopamine. Do you ever see a Parkinson's patient walking around like this? No, that's a guy that used to wear a zoot suit, okay? What do they look like? Okay, why? Because the head is being pulled and they need to get movement to stimulate the dopamine production. Here you go, 90 days later. She came in a wheelchair, then she was in a cane and a walker. okay, or a walker than a cane. So, I mean, you can see, restore that curve, what happens? You're not giving them levodopa, okay? You're actually restoring the normal brain supply. This is the philosophy that the body is self-healing and self-regulating. If you're looking for a disc injury, this is a person standing up straight. You can see some abnormalities. When they bend off to one side and bend off to the other side, you can actually identify disc problems. Here you go, 7 back surgeries. They still had back pain. Before and after, can you see a change in structure? Yeah, why? We're looking at this, we're identifying a problem, we're fixing the problem, then we're taking a post x-ray to fix that problem. Okay, so here's what you do if you got a scoliosis. 24-degree scoliosis, you take a bending film. Why? Because if you bend this and it doesn't change, it's stable. If you bend it and it does change, that's the minimal amount of correction. Okay, so she goes from 24 degrees, she bends out 18 degrees is her goal. Whoops, we got it down to 15, so guess what? It's time to take another goal. Bend her again, now she goes down to 12 degrees. So now what's her new goal? 12 degrees. Okay, does that make sense? This isn't rocket science. Okay, it's pressure over time. It's changing proprioceptive firings. I mean, we look at this. This is a medical nightmare. This is a leaky gut, that all black stuff in the x-ray that you're looking at. That is just a destroyed immune system from, guess what? Vaccines? Absolutely. Not just vaccines, but then the ear infections, the antibiotics, everything else. Thank God this is her gut 90 days later. Normal gut. Luckily, guts heal fast. Then you get this. Okay, here are twin girls. If anyone says vaccines are safe and effective, watch this movie. Here's 2 girls that actually went through the vaccine court, and one that the DPT caused autism in them. Okay, now, I want to show you this. This is a normal gut here. That little tiny half moon thing is called a Magenblase. That's a normal gas bubble in a stomach. Do you want to see what a really bad Magenblase looks like? Looks like someone shot her with a shotgun. Now, with serotonin produced in the gut, do you think she's going to have behavioral issues? Do you think that the destroyed gut is going to negatively affect her? Oh my God, this is agony. If anyone's ever seen an autistic kid, they're in freaking agony all the time because of destroyed gut, inflamed mucous membranes, everything. We don't treat that. But guess what? They're now becoming verbal. Why? Because we're restoring that nervous system. We're restoring the autonomic function. The gut is starting to heal. They're starting to poop. And they're actually starting to be communicative, which is amazing. We had one of the gals, because they're twin girls that come from Arizona. Oh, and by the way, California and the militaristic Nazi regime that we're living in now, or tyrannical, these guys have proven in court that the DPT caused autism. If they come to California, guess what? They'd still have to be vaccinated with everything other than the DPT because of SB 277. I know, forced medical procedure without consent. Here you go, here's a screw up. No comments, and his wife gave me the comment too. I always knew he had a screw loose. Okay, no, this is a plate, okay, on his neck. Now the neck is supposed to be in a curve, but you'll see that the neck doesn't have a curve. And you might say, well, that's 1 screw, 2 screw, there's a missing screw, and there's a screw on the top. That's because they didn't want to go out and get a custom-made plate, because why? Everybody's about the same, right? No. Neck pain and arm pain after surgery, still arm pain. Okay, so, and the reason is, I mean, we're still helping him, but you've got this metal plate, and you can see the 2 screws missing there. If they put these screws in there, it would have formed the curve, because the curve decreases pressure on the neck. Remember, the curve in the neck is called the arc of life, and they just made a mistake. This is the man's neck. How can you make a mistake like this? I mean, how would you like to go through with your hand never working right? I mean, that's criminal. B.J. Palmer, medicine is the study of disease and what causes man to die. Chiropractic is the study of health and what causes man to live. When we go in and we talk about the 5 keys to healing, when we talk about first you have to get your nervous system checked, can you see why? Not only does it control and coordinate every function, but most diseases don't even exist. Okay, they're just there. Okay, it's a presentation or it's an adaptation to deficiency and toxicity. Regular exercise, because you gotta move every day. That's just how normal human beings are. Proper nutrition, if man makes it, you don't need it. If it's healthy, free, organic, I recommend everyone read the book, The Blue Zones. You're talking local, organic, healthy, seasonal. Sufficient rest, that means deep sleep every night. And prayer and meditation. Does that make sense? Any questions? Yes, ma'am.
Is it advantageous to have multiple adjustments in one day, or could you have like 3 adjustments in one day a week? Would that work, or does it kind of settle back down again?
Well, it's actually, the adjustment is not moving the muscle or bone. The adjustment is changing proprioceptor responses. It's changing the way the brain views the body. So the more stimulus up to that brain you get, the more effective the care. And so to get them packed in closer is better. I mean, we'll do 3, 4, rare cases like 5 adjustments in a day. I met at this seminar and I'm thinking, because we're doing post x-rays in 3 weeks, showing great changes. I mean, doing some really cool stuff. I thought we were really cool. I meet a guy at the seminar who does 8 and 9 adjustments in a day, gets post x-ray changes in a week. I mean, not as good a changes as we get, but I mean, to do that. So I'm going to go up and check his clinic out. It's north of Washington. So I'm kind of excited because, I mean, anytime I can learn something new that I can incorporate, it's neat. But think of it, and there's another thing. When people say the adjustments aren't holding, that doesn't make any sense at all. We're restoring new motion. We're changing the way the brain views the body. So it's not we're moving it in place. It's a dynamic relationship there. We're moving it so it can move correctly. And the closer to normal we get it, the more it wants to stay there. That's how brilliant the body is. So we get, 15, 20 adjustments now, then I don't see you for 6 months. Unless you've gotten into an accident or forgot to do the supportive exercises or have excess physical, chemical, or emotional stress load, you're going to come back, you're going to be fine. Okay.
So if someone was coming from like a 2-hour drive and they just want to spend one day, get 3 adjustments, and they come back next week. One day,
Oh yeah, that's totally okay. Yeah, totally okay. Yeah, because we'd give them an exercise for the car to where we can turn driving into therapy. Yep. Yes, ma'am.
So in the case where somebody's had extensive back surgery with pins and everything in there, is it still an option to work with those backs?
You have to. You have to. That's why I'm showing you the post-surgery cases. We have 27 surgeries, there's only 4 mobile segments, and this is the only care they get. We're talking multiple surgeries in the neck. We've got one gal whose entire cervical spine is fused. And she's coming in with a problem that's usually a really easy fix. It's called trigeminal neuralgia. We adjust C1 and we adjust the jaw and it goes away. Now with her, I can only work on the skull and the jaw, and it's already helping her, which blew me away because when I go in there, I'm actually like really honest because it's always nice to fall back on the honesty. I don't know if I can help you because this is a C1 issue. If I got access to C1, man, I'll guarantee the results. Yeah, so, and then it's like the guy with the screw loose. Don't argue. I mean, in defense of the surgeon, because he's using a plate and it was probably a lot cheaper, the screw holes were right in the middle of the disc, so he couldn't put it in there because there wasn't anything for the screw holes to grab. I would have liked to, measure before the surgery, have a custom-built plate, maybe a little forethought. That would have been cool. But it's only a man's life, so it's a lot of prep work there.